Hello, I'm Dr. Kuyunov here at Dental Prosthodontics of Rochester. We get a lot of questions about what is full mouth reconstruction and what are the different treatment options are. So in today's video, I'm going to cover some of the options for full mouth reconstructions, and I hope I'll be able to answer some of your questions. So what is a full mouth reconstruction? A full mouth reconstruction is when a patient needs to remake all of the teeth in the mouth. It could be either upper teeth, lower teeth, or natural teeth, or no teeth at all. Who would be a good candidate for a full mouth reconstruction? Good candidates can be people who um, coming from few categories. One category is people who grind their teeth and they ground them to a very minimal tooth structure. They'll be good candidates for full mouth reconstructions. Another group is people who have for some reason teeth became really short. It could be because of an inborn defect or because of erosion from acid, whether it's a GI problem, gastroesophageal reflux disease, or it could be acid from consumption from the diet. Lots of sodas and sugar drinks that can also produce acid and erode the teeth. So when the teeth become really small, a good solution is to consider full mouth reconstruction. Um, yeah, other categories of people are people who lost most of their teeth and therefore they need a full mouth rehabilitation to provide them with new teeth in order to smile with and to chew with. Whether it's they lost all of their teeth or many of their teeth, and the remaining teeth are either can be used for the full mouth reconstructions or they cannot be used for a full mouth reconstructions, and we have to start from scratch to rehabilitate the person with other techniques. What can disqualify someone from being a candidate for a full mouth reconstruction? It's mostly health issues. If a person, due to health issues, cannot really sit on a dental chair for a full mouth reconstruction, it also could be that a person who does not have good oral hygiene and will not take care of the teeth in the future, full mouth rehabilitation will have not a very high success rate for people who do not have good oral hygiene. So it's really a requirement for a hygiene. Inborn conditions, maybe medical issues. What are the different options for full mouth reconstructions? Full mouth reconstructions, full mouth rehabilitation can be done with crowns or inlays onlays. Crowns are caps that go on the teeth and they encircle the whole tooth and give it a strength and bulkiness that the tooth once had and now is missing. So with crowns, it either goes on individual teeth. If some of the teeth are missing, instead of crowns, bridges can be placed, and a bridge replaces some of the missing teeth as well. Full mouth rehabilitations can be done also with veneers. These are mostly aesthetic full mouth rehabilitation, where a patient wants to a brand new smile, a whiter smile, something to change in the aesthetics. Then veneers can come into play, and these could be really beautiful rehabilitations. If the patient is missing a lot of teeth, full mouth rehabilitation can be done with either removable appliances such as partial dentures or complete dentures. It can also be with fixed prostheses such as implant retained or implant retained prostheses, or implant fixed prostheses such as all-on-X type of solutions or bridges over implants. Is a general dentist qualified to perform full mouth rehabilitation? Uh, uh, Anyone who has gone through proper education and training should be qualified to do full mouth rehabilitation. This training, uh, finishing a dental school, is often not enough to be qualified to do a full mouth rehabilitation. So general dentists who pursue this type of treatment, they have taken a lot of continuing education. Some of it was weeks, and some of it was months. Really good. And some people have gone back to school and got even more training. These are usually prosthodontists, and they went through extra schooling to learn how best to do full mouth rehabilitation. What is the process for going through a full mouth rehabilitation? The process starts with initial visit and the diagnosis. Patient comes, lots of records are being taken. Most of them are pictures, x-rays, and medical history as well, and checking what is the problem of the patient, so we can actually address the underlying problem that caused for tooth loss, and also asking the patient what are his or her desires for future, and uh, going through the questionnaire, asking what type of prosthesis or rehabilitation would a patient want. Is it a fixed or removable, and is it on implants or on teeth? And going through all these questions, this will be the first appointment. Once this is completed, this decision will be made between the doctor and the patient of what type of rehabilitation we will provide. And then once the commitment is reached, the process can be started. Usually this process will take anywhere between 3 to 6 months to 12 months, and sometimes even 2 years. And in 2 years, processes are those that usually require some type of orthodontic tooth movement into proper position. And once orthodontics are completed, only then can a prosthetic phase begin. How long does the full mouth reconstruction take? It can take anywhere between 3 to 6 months and almost up to 2 years. Really depends on what type of treatment is given. If orthodontics are involved, these usually take longer. It takes anywhere between 6 months if it's limited to 12 months, and sometimes even 2 years if it's a heavy tooth movement. Other reconstructions can take anywhere between 3 to 6 months, whether it's on teeth or on implants. With implants, there is an added waiting time for the implants to integrate into the jawbone, so this can take anywhere between 3 to 6 months. In general, 3 to 6 months is normal. Up to a year is also normal. What anesthesia options are available during the full mouth rehabilitation process? If it requires heavy surgery, uh, we may elect to go with a moderate to moderate sedation to moderate conscious sedation to maybe even general anesthesia. It really depends on what is the medical health of the patient and how much can the patient go through. If it doesn't require heavy surgeries, then just a local anesthesia should suffice. And with local anesthesia, there is no pain during the procedure, so it should suffice in most cases. How long does it take to heal from a full mouth rehabilitation? Usually the first week is really the most impactful week, where there will be soreness and sensitivity. All of this can be really treated with pain medications, and as long as you follow your doctor's recommendation, pain should be at the minimum, or really minimum. After the first few weeks, the first week and then few weeks afterwards, the body is healing itself, and things can go back to normal. There is a whole list of what to do and what not to do for patients who go through mouth rehabilitation, but the first week is really the most crucial. After the first week, things are usually good. Are there special care instructions following full mouth rehabilitations? Absolutely yes. There are special instructions that the patient has to follow, and these include oral hygiene, proper oral hygiene, which will specify what to do in the first week and what to do after the first week. This also includes diet. What diet can a patient have? In some cases, it's just soft diet in the first week. A heavier rehabilitation with implants supported prosthesis. If implants and prostheses are being placed and it's being done at the same day, this type of rehabilitation requires 3 months of soft diet until those implants are being held strong in the bone. For the most part, after the first week, things are easier. After it is completed, the full mouth rehabilitation, a patient is required to follow up with his doctor for the hygiene visits and making sure that things are good and healthy. And if anything happens, just to make sure we catch it earlier in the game, because it's easier to address things when they are just start rather than when they're advanced. Will the full mouth rehabilitation last for the rest of your life? Ideally, our goal is that whatever we do should last for the rest of a patient's life. However, we know that sometimes it's really not the case, because everything has a certain time to it. There are wear and tear on any rehabilitation we place, and if natural teeth have failed for a patient, the prosthetic replacement teeth, even though we are using the strongest material, very, very strong material, they will also have their weaknesses, and with time, things may happen. That's why you should see your doctor after the rehabilitation to make sure that things are good. And if in the future, in 10, 15, 20 years, replacement is needed, we are well prepared for this type of replacement. And it will be much easier to replace when we are following up on the patient. Will dental insurance cover the cost of the full mouth rehabilitation? I really hope so. Unfortunately, most dental insurances have a maximum to them, and they will cover some cost, but very soon you will reach the maximum benefit from dental insurance, and the rest of it will not be covered. Usually, full mouth rehabilitation, full mouth reconstruction, these are big treatments, and they go well beyond the dental insurance coverage. Are financing options available to help you pay for your full mouth rehabilitation? Absolutely yes. Most offices do provide some type of payment options and financing options to help patients reach the health that they are required with the full mouth rehabilitation. How can you schedule an appointment to talk about full mouth reconstruction? The best way is to reach us either through our website or call us on our phone number and schedule an appointment, and just mention that you need a full mouth reconstruction or an evaluation. Will give you enough time to examine you and come with the proper options for you. I hope I've been able to answer some of your questions about full mouth reconstruction. I'm happy to help with more information. If you do require a treatment such as this, please don't hesitate. Call us to get more information. Our phone number is 585 471 5689. Thank you.